Good morning and thanks for waking up with us. On today's episode, I'm sitting down with pediatrician Dr. Michael Magalnick, and he will share some helpful tips on how parents can ensure their children have a healthy and productive year as we head back to school. Well, good morning. Thank you so much for joining us this morning, Dr. Magalnick.
Thank you for having me, yes.
Well, let's jump right in. Tell us a little bit about yourself and your experience.
I kind of came here in a different route, I guess, than some other people may have, but I was born and raised in Phoenix, Arizona, and I grew up there. And I did my training with medical school and residency, both there. I have married to my wife, Claire. We've been married for 12 years, and then I have two kids, Oliver and Abigail. So we have a 7-year-old son and a 3-year-old daughter. And just over the past maybe couple years, we kind of decided maybe we'll make a change in our life. Maybe we'll move to a different area of the country, you know? And so, crazy as it may seem, the Midwest was kind of one of our top priorities of kind of where we wanted to move to. You know, kind of move to a place with more community, a place for our kids to play outside, really kind of spread their wings and kind of enjoy kind of childhood. And so we kind of looked for places and kind of honed in on Wilson as an area that maybe would be a great place for us to kind of move to for me professionally, and then kind of got here and now I've joined the practice and I've been really happy and it's been fantastic.
Great. That's great. Well, welcome to Wilson and welcome to Ohio and the Midwest.
Thank you.
Let's talk a little bit about pediatrics and the specialization. What made you decide to go in that direction and specialize in pediatrics?
So I would say I had kind of some family members in the past that kind of were kind of in the medical field, and kind of so that kind of leaned me in that direction. I'm thinking, would that be something I always wanted to do? And then I always kind of thought kids were a great population to deal with. You know, they're always kind of sometimes trepidatious to see you, but they always kind of have smiles on their faces, and they're a great population to kind of deal with, and you really feel empathetic and, you know, kind of like you really want to help them when they're hurt and when they have things going on, and so it's kind of a very rewarding position to be in.
We always like to take these opportunities and talk about some relevant information, and it's back to school for kids.
Right.
And I thought it would be helpful to share some tips from your perspective on what parents can do to ensure that their kids have a great school year from a health perspective.
Right. I know kind of at this beginning of the year when the school is starting and everybody kind of has nerves or excitement, there's always kind of different mixed feelings. I think the main thing that you try to do with your child is really get them in a good routine, you know? So obviously summer has its own schedule sometimes, right? Maybe they're up later, maybe they're sleeping later, maybe they're busier later in the night, they might be spending, you know, time at friends' houses, different things like that, which are all great things to do, another kind of family time. But you know, when you kind of get back to the realm of school, if they haven't slept well, it's going to be harder for them to focus during the day. So I think initially what you do is, okay, what's your normal routine of when you want them to go to bed? You know, is it 7, is it 8, is it 9, depending on the age of the kid, and what time are they getting up for school? Is it as early as 5, is it 6, is it 7, you know, to make sure they're getting ready for the day. And I would say maybe a couple weeks even before school's going to start, you're just kind of getting into that routine, you know, so maybe getting to bed at the right time, making sure their routine's kind of getting all set up, making sure they're getting up at the time they would be needing to get ready for school, you know, and kind of getting to that routine. Maybe even working on kind of meal stuff, you know, having a good solid dinner at nighttime, good solid sleep, wake up in the morning, have a good solid breakfast, things like that.
Great.
And then kind of making sure that they feel like their body is in tune with what's going to be happening for the next 9 months or so, you know, as they're in the school year.
Okay, great information. You know, we talk about sleep and the importance of exercise, and I can't help but bring up electronics usage.
Right.
In today's society, it seems like everywhere you turn, somebody has a phone or somebody has an iPad, and even our youth, even our children. I would like to hear your perspective and your expertise on electronics usage, and you know, what do you think? How can, especially going back to school, you know, the limitations that should be put on kids with electronics usage?
So I think every family probably has a different feeling on this. I mean, as a pediatrician, kind of the overall, I guess, opinion and statement would be an hour or 2 of electronics a day would kind of be where you'd want to stay in. Now, I'm a father of 2 kids, right? So it's easy for me to say, keep your kid on a screen for an hour, then shut it off and do nothing else. But you have to be realistic here a little bit too. And so I think it depends on how your family dynamic is set up here a little bit. But I would say, if you think that the overall screen time is affecting their ability to get homework done, to kind of be an active participant in the family or with kind of friends outside, then I think that's when issues kind of arise. And then maybe you kind of pull back in a little bit with some of the amount that they're using it for. And I think people have to realize what a screen is, right? So I think people just kind of think, oh, if they're on a tablet, that's screen time, right? But Cell phones have screens, computers are screens,
Right.
televisions are screens. It's all screens, and so I think our life has increased in our volume of screens that are accessible. So it's really remembering to kind of knock that down a little bit with how much they have access to and kind of how long they're on those things. And then what you'll see with kids is the more accessible they are, if they have their cell phone, if they're an older kid, if they have their tablet, if they have a television in their room, that really affects their sleeping pattern, that affects what they're doing. Because no matter what they're saying to you of, sure mom, sure dad, I'm going to sleep, they're sometimes up, texting a friend or looking on a social media site or looking on the internet. And when your mind and your body is trying to focus on so many things going on in front of your face, it really can affect your body's ability to kind of relax, settle down, and fall asleep. So I would say if you are seeing that maybe they're not getting as restful sleep, you think during the day they're kind of seeming a little bit more sluggish, you really look back at that nighttime routine and that what they're doing after they come home from school and kind of what's happening there to see if there's things you can change in order to make them more successful for the day going forward.
Great, that's great information. I also want to talk about vaccinations. Again, back to school, kids are going to be around other kids are going to get sick. It's always a topic we like to discuss as we continue to educate our community on the importance of vaccinations.
For sure.
Would like to get your thoughts.
So vaccines, I feel like always have been a hot topic, probably in my career of medicine, and I think sometimes they get a rap of, why do they exist and why are they there? But from a medical perspective, and for a lot of the community still, I think they see the benefit of what they do, I mean, there's a lot of diseases and illnesses that don't exist anymore because vaccines exist, right? But there's now things that are coming back that we can see, for example, measles, where you kind of have outbreaks coming around even into Ohio that didn't exist before at the beginning of my medical career, right? And so it shows the importance of why these vaccines are good things to do, And I think the thing we have to remember is, as school starts, you're coming into a large community where there's kids of different, they have different, immune systems, they have different abilities to handle different illnesses, they have different kind of exposures in a way. And so when you kind of go into this melting pot, if you don't have that vaccine to protect you against certain things, then your level of being exposed to some of these things obviously is heightened. And if you have the protection, then I feel like you're more likely to kind of be able to deal with any issue that might come out.
You mentioned in the beginning of the segment how happy you were to be here and the great team at Wilson Health Medical Group Pediatrics. Talk a little bit about what makes your practice so unique.
Yeah, I think it's kind of amazing, just kind of being here over the past couple of months. There's myself, there's Dr. Soleil, who's a pediatrician. Then we have Abigail Fisher, who's a nurse practitioner, and Lindsay Odell, who's a nurse practitioner. And then Dr. Godasara, who's been here, I think, obviously much longer than the rest of us. But we have a great camaraderie. I think everybody's working together as a team. We're trying to really build a great pediatric presence and kind of practice here in Sydney to kind of fulfill what the population around us needs and the surrounding areas too. And I think it's just been a really enjoyable place to work. And I think we're really trying to work together as a team to kind of fulfill needs that we see that aren't being fulfilled yet, and really kind of try to broaden what Wilson does on the pediatric kind of game, if you will, to kind of explore different avenues that haven't been done yet, whether it's doing kind of studies in certain areas if we can, whether it's kind of doing more outreach, spreading our wings, kind of a social media perspective, and really kind of reaching out to different patients and giving them access to us so they can get to know us, ask us questions, feel comfortable with us being the pediatricians and kind of the caretakers for their kids, so we can kind of build that relationship in different ways, which is kind of an exciting opportunity.
Right. It sounds like to me really a strong focus on education and prevention is really the approach at Wilson Health Medical Group Pediatrics.
For sure.
And what a great role you guys play in the lives of those little ones. So,
right.
Well, thank you so much for being with us this morning, Dr. Magalnick. It was great information, great to hear, and I think very relevant, timely information for our audience.
Great. Yeah, thank you for having me.
Join us next time, where we will be raising awareness on the importance of early detection and education and prevention for breast cancer.